the experts panel, and based upon that recommendation, we requested the closure of schools and the voluntary cancellation or scale down of various events. Measures had been taken, or we've been recommending people to wear facial masks or conduct frequent hand washing. And by taking such measures, we think that we've seen benefits to a certain extent. But in the previous report of the expert panel, it was mentioned that they would be able to assess the situation around 19th of March. So we are waiting for their conclusion of the assessment. And we will probably be able to respond to that question after we obtain the opinion of the experts panel. To supplement to that, in principle, it was as mentioned already, but from the members of the experts panel, we've obtained some comments. To give you some example, sorry, this is just off the top of my head. I don't have the written comment at hand, but because the general public responded to the request from the government, and because of the scale down and cancellation of various events, and because of the health expert activities in municipalities and doctors' activities at municipalities, with such response from the general public to a certain extent, we are sustaining the situation and controlling the situation. And as was mentioned, the evaluation conclusion will probably be made public on the 19th of this month. Radio France, National Radio Station France, correspondent, my name is Nishimura. To confirm, close contacts of infected people, can they really receive the PCR test? Close contacts of infected people, it's not the case that they would always be receiving PCR. They would be monitored 14 days for health monitoring, twice a day temperature measurement, and if change of the physical status occurs, then that would be reported. And on top of that, taking into consideration the spread of infection, there could be cases of PCR tests being performed to those subjects, but that would be dependent on the judgment of the local health station or the judgment of the municipality of the clusters. But just because PCR tested negative doesn't mean that that person is not infected. We don't uniformly perform the PCR test for all contacts. Now, next question. If I read the report of the experts panel, in Japan, say there are 5 people infected, then 4 out of the 5 would not spread the infection, which means 80% would not infect other people. How did that conclusion, how was that conclusion delivered? If you don't perform PCR tests, I don't think you can tell whether certain infected people infected others. That calculation is done through the 14-day health monitoring. And during the 14-day health monitoring, have there been symptoms emerging? And it's not that we count the number of those who tested positive in PCR tests. So, but there are many asymptomatic carriers. So that only means that there aren't so many people with symptoms, right? Rather than concluding that 80% of the infected people don't infect others, you should say that you haven't seen symptoms from the 80% infected people. Well, the last point was calculated by experts, so my interpretation of that comment may not be correct. But as I said, it's not the case that we uniformly perform PCR tests to close contacts, so that would depend on whether symptoms emerge or not. But in general, epidemiologically, it is our understanding that symptoms are the basis of the calculation. And what's the percentage of asymptomatic carriers and what's the percentage of those who observe symptoms? WHO says that there are asymptomatic carriers, but WHO says that they don't know the percentage. The asymptomatic carriers may not be such, may not account for such high percentage. I don't recall the wording of the WHO, but that was more or less the line that they had said. But this number could also fluctuate with time. In other words, with number of infected people increasing, the number of transmitted cases will also increase. So once again, we have to renew the calculation to see whether the updated number is correct or not. Final question. Yesterday, WHO called for tests, and yet the Japanese government's PCR testing policy hasn't changed, even with the WHO calling for more tests. Yesterday, yes, we are aware that WHO delivered an explanation, but what WHO was saying was for those who are suspicious cases, then tests ought to be performed for suspicious cases. And it's not that WHO is calling for tests to be performed for everyone in the population, to the general public. So we are performing the test based upon the policy set forth by the WHO. Dr. Tedros' concept, we, of course, are not sure whether we 100% understand his judgment, but we are constantly contacting the WHO, and we believe that we are responding based upon the policy set forth by the WHO.
Thank you. Rocky Swift with Reuters. I want to return for a moment to the report that Ms. Rich brought up from Imperial University and published by, I believe it was Neil Ferguson. This study, this model, has been cited as having a significant influence on UK and US policy in the past few days in changing their policy towards this crisis and making more stringent the measures on public health and testing. So, has this report been considered by your expert panel and the health ministry? And can we expect any, you mentioned the expert panel may be meeting in the next few days. Can we expect any more stringent measures in the next few days regarding this report or any other information? Thank you.
Of course, the MHLW team and the experts are trying to collect data from all corners of the world, and Imperial College has come up with a report, and of course, we take the report into consideration.
What is important is we have to think in a very comprehensive manner, taking into consideration a lot of things, particularly in Japan for the past 1 week or 2 weeks. We have to observe the situation very closely. That is indeed necessary. And in doing so, not only the number, we have to look at clusters as well. So to what extent clusters are contained, for instance, that means that there is little chance of patients outside the clusters. Then why these patients are infected. If we don't know the reason, then we have to try to figure out how many people are infected around that. Therefore, I think cluster countermeasures is very important. We have to look into clusters. And for that, we use a lot of resources in order to respond to clusters. Inclusive all these things, perhaps around 19th of this month, expert panel will be held, and they will be expressing their views and opinions. And after that, the government will make a decision. That is how things will flow from now.
Isabel Reynolds from Bloomberg News. I'd like to ask a related question about social distancing. This is just based on my impressions, but I feel as though the kind of jishuku mood is somehow becoming a bit more relaxed recently. When I look on social media, I see a lot of very crowded shopping streets and different places around Tokyo. I was wondering if you are satisfied with the degree of social distancing that's going on in Japan at the moment, and that's one question. And the other one is about the new law on coronavirus. I still don't quite understand to what degree it is compulsory. So how far can local governments, I know they are able to ask for restrictions on the use of facilities, can they actually force that? Or not?
With regard to the first question, this is MHLW answering. With regard to social distancing, it is difficult to evaluate how the situation is in relation to social distancing. We make a request. We are asking people, continue to ask people to carry out social distancing, contained space, closed space. Even in that space, if there are many people in that confined space, in addition, people are talking to each other, singing with people in such a situation, there is a high risk of infection. Therefore, such activities should be restrained. We have been communicating such risks through various channels. We have been quite vocal. Having said that, this is simply a request from our part. Therefore, I think there is a limit to what we can do in terms of effectiveness. At this point in time, to what extent this request has been effective, we are going to assess going forward. And that is indeed where we want to listen to views of experts in the expert panel meeting. Let me add, in general terms, social distancing effectiveness. On the 19th of March, when the expert panel meet, I think that will be discussed as one of the topics. Among experts, as you mentioned, in the beginning, a social distancing concept is kept and maintained by people. However, people become fed up with that, and therefore some experts say that we should articulate the efforts from time to time, or sometimes the experts are saying that we have to be more stringent in enforcing social distancing. So there is a difference of view, so we would like to seek consensus among these differing opinions toward the 19th of March, where expert panel meets. The second point, the revision of special measures law, to what extent that is enforceable, compulsory measures can be taken under the law. That was the second question. The state of emergency, whether that is declared, even if state of emergency is not declared, even in that case, the governors and the prime minister of the country, vis-a-vis medical service providers, they can request and instruct medical service providers to provide medical service. And so this is a request, that is a request and asking people to do something. And however, it is based on the voluntary intent of those who are asked to do something. And when instruction is given, instruction is compulsory. Under the law, people have to follow such an instruction. But in the case where instruction is given, in many cases, the supplies are to be concealed or hidden. Except for such a cases, there is no penalty. For example, restriction for the use of facilities. If there is a request to be followed by instruction, however, against such instruction, if some people continue to use the facility to have a concert, for example, there is no penalty under the law. Having said that, since this is in Japan, just because request is made, people would follow. And if request is not followed, and then instruction is issued and not followed, that is unlikely. Another point, so request and instruction, there is a, when we make a request and instruction, we make that announcement. Sorry, I didn't explain in a very good order. So if there is a request and instruction to limit the use of facility, so that is applicable, that is to be done by the governor where state of emergency is issued. So maybe it's not very easy to understand. So that is the overall picture. And basically, before instruction is issued, request is given. So only when request is not followed, instruction will be issued. Thank you very much. I have 3 questions. Firstly, Kashiwagi, I am with Washington Post. Thank you for the opportunity. I have 3 questions. First, the number of fatalities. In Japan, the number is quite limited. It's not increasing in Japan. The background to this situation, in what way currently you can keep such a low number compared to other countries? The fatalities are quite low in Japan. And at the same time, this disease, the elderly has a higher risk of becoming seriously ill. However, those who are seriously ill are limited in number. So there is no cures and medicines for this disease. What is your current analysis of the current situation? In the normal pneumonia, in that case, Japan has a low such number of fatalities. And third question, those with mild symptoms, without close contacts, they have ordinary cold-like symptoms, so they go up in the street, and maybe these people may be carriers. What is the size of such risk? It's difficult to think of such a risk. Those with mild symptom being a carrier, actually. First question, the number of deaths. I think there are many reasons. So it's not only simple one reason. Firstly, in Japan, we have a health insurance system for all, which is functioning very well. Universal health insurance system. Therefore, if people are worried, they are able to visit medical institutions, hospitals, without any worry, without regardless of their earning level, income level. Another possible reason is that in any prefecture across the country, you are able to get a very good level of medical services, medical institutions for respiratory diseases. There are key such medical institutions for respiratory diseases exist in all prefectures. Therefore, the system is well equipped. And thirdly, the patients who are now hospitalized, in-hospital infection is effectively prevented even before this disease emerged in Japan. Therefore, we have a system that ensures to prevent in-hospital infection. So doctors and nurses are working so hard. Some people do not even sleep during the night. And another point, so they are to be given credit. And another point is the patients, inpatients, when there is a large number of hospitalized people and giving a stress on normal or hospital situation or medical service provision, that is not happening yet. So the situation is not yet overwhelming as of now. So medical service is not collapsing as of now. So necessary treatments are being provided. So such a system is well in place. Virus infectious diseases, there is no effective cure like influenza in the case of novel coronavirus. However, the normal respiratory management and also infusion can be provided. And through such treatment, there are many patients with the power to recuperate from such a novel treatments. So I think that is working as well. The risks associated with the risk, the elderly, as you say, is high. To the extent we know, those who are in their 70s, 80s, and 90s, these people, we are seeing some fatalities among these age groups. Actually, the pneumonia actually ranks number 3 killer in Japan. Therefore, the pneumonia itself is a high-risk disease for the elderly. And those with mild symptoms may spread the disease as a carrier. Yes, we have recognized this risk from the beginning. And some time ago, experts produced this poster. The young people are not to be blamed. However, in the case of young people, they will not become seriously ill. Therefore, these young people may turn the elderly more vulnerable. The people without big physical strength may be affected by the young people. Therefore, the habits and behavioral pattern are to be reviewed. So this is the poster requesting that in the case of new coronavirus, we have issued a guideline for consultation. The first thing it says is that when there is a cold-like symptoms, please stay home. Please do not go to work or school. That is the first request we make. And that is because we want to prevent the carrier spreading disease.
Sorry, thank you, Motoko Rich from the New York Times. I just wanted to follow up on this question of the clusters. In looking at the conditions, and you mentioned that, and the Prime Minister also mentioned in his press conference on Saturday, that the conditions that have seemed to have led to these clusters are these small enclosed spaces where people are in close contact, perhaps speaking or singing. Why has that not led you to perhaps request that bars or restaurants be closed down, as that request has been made in a number of countries now as a result of similar conditions leading to outbreaks?
We've made the request. The national government has made requests to venues that are closed, where many people gather together and talk and converse with each other, are high-risk spots. So we've requested people not to create such space and make available such space. So this request has been made by the national government. Do we make this mandatory as an obligation? That's judgmental. Currently, we are relying on requests, and we have to see whether the requests have proven to be effective or not. And after we look at the effectiveness of these requests, then we will consider whether we need to proceed to the next step, and that will require a judgment. And other governments are also monitoring the situation as they decide on their own measures. And relatively speaking, Japan has more time to observe the situation in comparison to other countries. Of course, one option may to stop the operation of all of these outlets, but we will be watching the situation very closely. In the case of France, like Japan and other countries, most of the serious cases are elderlies, but there are young people too who have been infected. One commonality amongst the youth, when symptoms emerge, ibuprofen, if they take that drug, that exacerbates their symptom. The health minister of France is tweeting that information. The minister is trying to spread that information. Have you heard of such cases in Japan? And is the Japanese government trying to spread that information? In social network in Japan, some are tweeting that it's fake news. But in the case of France, the minister, who is a doctor, physician, is tweeting. So it's difficult to contemplate that it's fake news. In fact, with the taking of the ibuprofen, there are cases that have exacerbated. We've heard of such cases and we've heard of such reports. But in Japan, the correlations between ibuprofen and these cases have not been studied or reported. I'm also a doctor or physician, but using my imagination, despite you're not feeling well, you take ibuprofen that reduces your temperature and try to continue to work or study, and that may have worsened the situation. In the case of Japan, if fever continues for 4 days, then please consult your contact point. But even if you need to take medicine to reduce your temperature, maybe your fever is not that high, but you're not feeling well, so much so that you need to take in such medication, then please, if that situation continues for 4 days, please consult the call center. We're calling upon people to do that.
So, Mr. Swift.
Rocky Swift with Reuters. Recently, Aichi Prefecture has come out as one of the biggest clusters for the coronavirus, and in particular, there's been concern, as has been voiced a few times, about how this may impact the elderly. If this gets into an elderly nursing home or other type of facility, can you describe what steps might be taken in those cases? We've heard from some experts that it might be the Diamond Princess all over again, because these people can't be taken to another facility. Some ambulance services may be hesitant to transport them. If this gets into elderly homes or nursing homes, what will be the steps that you take to care for those people? Thank you.
Your point is very important, and we do have a sense of crisis, and we are aware that we need to take measures. Elderly's facilities are is a place of highly vulnerable cohorts, and we have to take measures not to spread the infection through those spots. So in order to prevent the spread of transmission in those facilities, we are calling upon the operators of those facilities to take robust measures to prevent intra-facility infection, and we're prioritizing those institutes for supplying facial masks and disinfectants. And even then, if such infection occurs at those facilities, at this juncture, if a PCR positive patient is discovered, then we ask them to transfer the patient to a hospital that can respond to infectious diseases, and those measures are well in place at the moment so far. And I guess your question is, what do we do about the other patients? We will respond case by case. What was the behavior of the person who was infected? Is that person in the facility, living in the facility, or just using the day services? That would also change the judgment. In the case of elderlies who are living in the facilities, these people in those facilities are not as serious as those who are hospitalized. So I think that it would be easier to respond to those cases. Kashiwagi of Washington Post. Thank you for this opportunity. And I also have a question on clusters. Other than those the clusters that have been spotted or cases that have been captured, in addition to the daily reports of the positive patients, how much are you tracing the close contacts? And do you constantly have data to respond to the increase of clusters? How are you tracing people who are not included in these clusters? You do the daily announcement, but are you tracking all of the close contacts of identified positive cases? What's the control system in place for tracing the close contacts? In Japan, epidemiological assay, active epidemiological inspection, we are prioritizing and placing weight on active epidemiological investigation, and one person transmitting to multiple people and infection being spreaded. That's the definition of a cluster. But other than such case, say there were 10 close contacts, but in the end, none of those 10 people became patients. Those cases are not called clusters, but those cases are also included to be traced by the prefectures. Even if they are not included or defined as clusters, we think that this is very important. We have to do the tracing in order to judge the degree of spread of infection. An assessment has to be done. So each prefecture's public health stations, they are working day in, day out on this matter, and staff from other divisions are also being sent to these offices because this assignment is being given top priority for the local public health centers. So my point is it's not just the clusters that are being traced, but other cases as well, and those cases are also given priority.
Ms. Rich, please.
Looking at the border controls, do you have any plans to issue more border controls or quarantine orders for people from the rest of Europe, or are you just going to continue to focus on Italy?
My name is UMEHARA of the Immigration Services Agency. On border measures, at the moment, there is no decision delivered to expand the measures from the ones that we've decided on, but every day we study the situation, and if necessary, as the Prime Minister said, we will be taking measures boldly without hesitation.
Please.
On discrimination, in Japan, those who have become infected, I think you're trying not to disclose the names and their identities. In France, there are several cabinet ministers who have become infected, and at least 7 parliamentarians have become infected. They've made such information immediately public. Do you have any advice or comments with regards to such policy? To what level of detail of information do we make public? That's a very difficult issue. Not just the novel coronavirus, but for all infectious diseases, there is the risk of that leading to discrimination. So privacy-related information must be well protected. That's important. But on the other hand, where are the places where transmission occurred, and what was the